Hello friends, today we'll discuss about these sexual disorders. So we'll be talking about sex, gender and related disorders. So to begin with, what is sex? Some basic definition terms you should be aware what they mean actually. They should not be interchanged and used vaguely. So what is sex? Sex is basically the biologically assigned sex, the external genitalia with which the person is being born. So this is the biologically assigned sex or the organs that are being a male or female that is being assigned with birth to a person. Second we have is gender. What is gender? Gender is the psychological aspect of a person, what a person feels or thinks about oneself to be. Like a person can feel oneself to be a male or female psychologically. Like a person is born as a female, but psychologically inherently she feels that she is a boy. It's like a man or a boy's body that is being given into a female body. So that is the psychological construct of a person. Psychological construct of a person. Psychological construct of a person, what he or she believes her to be. So this is psychologically what a person finds oneself. Third we have is your gender orientation, or simply at times it is told to be orientation. Orientation, it is how a person is attracted or affiliated to some person. It is feeling attracted to the other person. So if a person is feeling psychologically to be a male, psychologically a person is feeling to be a male, that is the gender is male. So the person is oriented to be of a male gender, so person would be attracted to a female. So how sexually attracted a person is to, that is to which person the person is sexually attracted. It can be a male can be attracted to a male as well, or to male female both. So this is the gender orientation of a person. Then comes your this is the orientation. What now we will talk about your gender role. It is the social or the responsibilities or roles that are being assigned depending upon the gender. Like if we talk, like if it is a male, what is the gender role? That person has to earn, protect the family, procure the family. Be it a female, then the female gender role, it is to do the household chores, take care of the family, raise children, etc. So these are the assigned social roles depending upon the gender. So these are the gender roles. Now we will talk about the gender identity disorders. So when there is a difference between the assigned sex and the gender that a person identifies one with, so there would be a clash in what we are born with and what we feel we are. So this will create dysfunction, distress in a person. So now we are talking about your gender identity disorders. So normally a person's identity, gender identity, it is formed at the age of 3 years. So this is a question straightforward. 3 years normal gender identity is normally being formed. So when there is, like I was saying, when the sex and the gender doesn't coincide, then there would be issue. So the biologically born genitalia or the gender sex that we are given does not coincide with what our psychological construct is there. So if there is a clash in this, then there would be a distress in the person. So when these are not same, it will produce an issue that will cause distress, and that is known as a gender identity disorder. In this, the person at your early childhood or at adolescence, usually at 3 identity is formed, but after this when there is a clash, so in childhood and adolescence there would be issues related to it, a distress reported by the person with this. So what could be the possible outcomes to this? Person can either continue to live in the same sex,